Are alternative therapies for SCA12 effective?
I get a lot of questions regarding extreme therapies like stem cell therapy, like a condition known as DBS, a therapy known as deep brain stimulation, that's brain pacemaker, and a therapy known as MR guided burning of area, because called as focus ultrasound therapy. So I like to touch upon this, and then we can talk one or two more questions. There are some medicines to improve the symptoms, like tremor can be improved to some extent, slowness can be improved, balance can be improved to some extent. There are physical exercise to help the patient. But patient, they want to get cured, and they ask me about various options like brain surgery, known as brain pacemaker, or deep brain stimulation. They also ask about a new modality where they use MR guided focused ultrasound therapy or burning of the area known as thalamus, area is thalamus, or stem cell. To answer these questions, I say that stem cell is, I say no, straight no, because stem cell, there is no evidence till date that it helps in such conditions. And the centers which are doing stem cell in India, somehow I feel that they should do a little more scientific work rather than commercial work. Second, I would say that regarding DBS, brain surgery for SCA12 or burning an area for SCA12. So these two modality, they may help in only tremor, and that too only partial. They don't help in balance problem. Till date, the evidence is very small. So if you have really bad tremor that you cannot hold something, then you can think of these two conditions. They are proven in other tremors like essential tremor, Parkinson's tremor, not in SCA12. But as part of therapy, there is no harm in going for that if tremor is really bad. But don't expect that whole disease will improve, right? Because the disease is not only tremor, it's also balance difficulty, speech problem. In fact, in some cases, DBS can worsen the balance. So I suggest about these extreme modality only when the patient has tremor which is troubling them a lot, and balance is reasonably good. Only then I suggest, and that too also in small number of cases.
Here we can see increased tremor of hand when patient approaches the target. We can see tremor over right upper limb, predominantly involving proximal part in assuming particular posture. Unable to walk on straight line. Patient often makes mistakes requiring support on tandem gait or walking heel to toe. We can see broad-based gait along with swaying towards both sides. This is cartwheel patients depicting gait ataxia.